How would you summarize Dr. Tiller's philosophy and findings that justify these late-term abortions?
Well, that's a very tough question, Megan, to try to summarize someone's philosophy here. All I can carry away from this is that by these criteria, no person who would want an abortion and a late-term abortion would be turned away from that. And so I presume that the idea here is to justify that surgical procedure. And these records on a psychiatric basis do not so justify it.
You mentioned earlier that Dr. Tiller used a lot of social reasoning to justify. Can you get into some specifics, some of the social reasons Dr. Tiller gave? I know you have some notes you can refer to.
Yes. Look, when you say, what do I mean by social, of course, but when you say that somebody will end up an uneducated person, that is not a psychiatric diagnosis. That is a social prediction, okay? And by the way, a social prediction certainly doesn't have, as we know in our country, does not have to be fulfilled if we offer social support. Occupational future. The person will fear family disapproval. Words of that sort. Those are all social reasons. I don't mean to say that if you do lose out in your education that that's not harm, but it's a social harm, and those kinds of things should be treated in a social fashion. And, by the way, re-supporting the individual, remoralizing her, giving her her strengths herself, she then, as we know, independently can demand the kinds of support that comes and that she would be entitled to.
So as you were reading from your notes, those were gleaned from the records.
Those are direct quotes from the records, sample notations from Dr. Tiller. If she was forced to carry it to term, she would end up as an uneducated person without occupational skills and have multiple other pregnancies and the like. Well, all of those things are social predictions and obviously become subjects, interest, and concern. But I'm saying, and we psychiatrists would say, will be avoided if we can get this person once again to feel what she's entitled to feel, namely that she is an independent individual with rights and proper approaches to her life. If you think and teach her that the only thing that can be done here is that this viable human being has to be killed in order for her to have anything in her future, that's a lesson. That's a social lesson that may well, in my opinion, prognostically take from her the sort of sense that she can overcome hurdles that life brings her. Now, that's not a psychiatric opinion that I've offered you either, but it's a social attitude or an approach to women in our country that, in my opinion, is more meaningful than proposing that if they carry a viable child to term, that their educational opportunities are lost, and they end up fundamentally having multiple pregnancies, multiple sexualities, that their sexual life is lost as a meaningful way, that they will never flower and blossom. If anyone was saying that in another context about a woman, he would or she would be, chased out of court.
Well, sure. I follow that line of reasoning very well. How do you believe Dr. Tiller, based on the records you saw, how do you believe he treats his female patients?
Oh, again, I can't say from these records how he treats female patients. I'm only saying here that the records carry with them, by the statements that I drew out from you, give the impression that a hopeless attitude is depicted, going along with the hopeless feelings that the patient has and brings to the clinic. Doctors are supposed to give hope to people and give support to people, and they have to believe that there is such hope to be found in them. And usually, by the way, for psychiatrists anyway, I can tell you that that kind of hopeful attitude comes out of taking the full history of the person, noticing not simply what life has imposed upon her, but what she has brought to life, what her strengths are. If we approach a psychiatric problem as though they're only deficits rather than assets for a person, we will never have an optimistic and future-oriented therapy for people. We've got to see their assets as well as their vulnerabilities to bring them on. And those don't come across in these records.
Dr. Mchugh, are you saying that it was just basically a cursory review of the current mental state of the patient instead of going back, doing a deep-rooted history of the patient?
That's what I'm saying. By the records, anyway, what is being looked at is the state of mind of the woman right at the time, in which the issues of the distressing aspects of her present context are emphasized, and her strengths, her assets, the things that she brought, and, by the way, our capacity to open up for her and broaden her horizons as to what could happen in the future for her is neglected. It's as though, from the records, that I can only tell you from the records, one has the idea that the purpose of this visit is to justify an abortion, rather than the purpose of this visit is to have a full psychiatric understanding of this person and see all of the alternative ways that she could approach her life. And of course, in these situations, because we're talking about viable fetuses and viable, we're doing it beyond the stage. We're talking about the loss of a life, the life of a pain-feeling, sensory-feeling, fully organized human being.